some donors came along and built a pediatrics unit, and then a surgical center so we could have access to cesarean sections, and then an HIV unit, and then a waiting mother's hospital where women could come and wait if they were pregnant. If they were pregnant in their village and tried to walk in to our hospital in labor, they would frequently deliver on the way, and they might die or the child might die on the way. So now we have a waiting mother's hospital where women can come and wait for days to weeks to sometimes months if they've had previous problems in pregnancy.
Okay.
So now we have a 132-bed hospital, which UPMB, Ugandan Protestant Medical Bureau, has rated the #1 hospital in Uganda for the last 3 years.
Interesting.
And that all came out of the bush. And it works with the community. It's called Bwindi Community Hospital. So we engage the community. The community is very supportive of this institution.
Well, I would want to actually know if their size and who they are makes them more susceptible to certain diseases than other Ugandans who may not be of their kind of structure.
The Batwa?
Yeah.
The Batwa, you can recognize the Batwa, a Mutwa. The Mutwas average about 4.5 feet in height, so they would not be on any basketball team.
Yeah.
They're very engaging. They like to sing and dance. They know the ways of the forest.
They could play the rugby better then.
Yeah. Yeah, they can sneak around. They're very engaging. They have a great sense of humor. In their language, they don't use much of a past tense, a future tense, so they don't regret being moved from the forest.
Okay.
We live next to the Bwindi Impenetrable Forest, which is home of the endangered mountain gorillas. 650 mountain gorillas in the world, half of that population is within the Bwindi. So in 1992, it was made a World Heritage Site in order to protect the mountain gorillas. Good news for the gorillas, bad news for the pygmies, and the pygmies got evicted.
Definitely.
But they're very short people. They like to sing and dance. They like to have a good time. Occasionally drink too much tanto and wargi, but in other words, they're very good people, and I enjoy it. And they're my friends. There's about 1,000 pygmies that we work with in that area.
Okay, and the hospital comes to win the Stars Award. What exactly brought you to this point? Because they seem to have very, very strict yardsticks to getting to this particular award.
Yeah, that's true. The Stars Foundation is based in London, and they engage in helping disadvantaged children all over the world, especially in developing countries. And they also have this belief that local NGOs, if they are doing well, maybe they could be empowered even to do better. And that these local NGOs, again, are better placed to perform because they understand the problem better than maybe someone coming from, out there and so on. They are people supposed to be knowing what the community needs most. And so beginning in 2001, I think that's when the Stars Foundation was launched. 2006, they have been giving awards to the best performers, especially in management, those who have exhibited effective management. And we had to go through a rigorous, kind of censorship. The criteria developed by the PricewaterhouseCoopers, is it? Where we getting it the other way around, I don't know. But we are looking at things like governance and accountability to stakeholders, how structured we are, having regular board meetings, management executive meetings, and so on. And the other area we're looking at was innovation. How innovative has BCH been? And here, actually, what also contributed to winning this award was that we have been thinking of ways of improving healthcare utilization in rural area like ours. And one of the things that we started was, we call it the health membership scheme. It's some kind of insurance, but not exactly insurance, but we get the community to pull together the resources so that they can afford healthcare at a cost they can manage.
How do they do this? Is this a form of taxation, because we have very many
Yeah.
private health clinics out there that
No,
maybe could
Yeah,
go
what
and
they,
look for. So,
what they do, we have, it's a prepaid service. Yeah? They contribute 6,000 as a premium, each individual per year, and that entitles them to a wide range of services, including surgery if they needed it, admission, and so on. And in so doing, we get the rich to subsidize for the poor, and the healthy to subsidize for the sick. Yeah, because most times when someone is sick, is unable, even to work. Most people do not have enough savings.
I know.
So when the morning gets up with a bout of malaria, then everything is collapsing on him. But this kind of scheme enables, such kind of people who would otherwise have been disadvantaged at such a kind of time to access the service. So that was, an innovative way of getting people to, instill actually this kind of responsibility in them, to know that health care begins with individuals.
Yes,
much as we talk about
important.
Government, but every individual has got a responsibility. And we have, in a way, managed to change their attitude, because we are using barrier groups. These were existing, I think, in the whole of Western Uganda. They were formed at the peak of the HIV pandemic. And out of desperation, because they were called Batakatwezichi, which means let's bar ourselves.
Exactly.
So you can imagine that kind of desperation. But we have turned that around, and now these groups are called Batakatwetambiri, let's save ourselves. So that has been part of the innovation. And then the other aspect has been use of technology to enhance health care. We have registered every individual in our catchment area at household level, capturing all their demographics, the education level, their dwelling unit, the state of their dwelling units, water source, mosquito net coverage, and all those things we have them captured onto our database. Now, this helps us, first of all, to do geographical health mapping. When we do, say, our annual surveys, we can exactly locate
who is
sick and where.
Who is not,
because we use the geographic information systems using the coordinates, longitudes and latitudes, so we can know that these people coming here with malaria are from this
area.
Yes,
exactly.
And again, using that kind of technology, we can generate a map that can show, that this parish we are having also people with malaria, and this parish we have also people with diarrhea, and therefore we can focus our interventions. So that brings in the element of efficiency. In other words, our resources have to be put where they are needed most. And the other criteria that was used, was our networking and collaboration. Bwindi Community Hospital, as Dr. Scott mentioned, we are located at the edge of the forest. A number of people have not been there.
Exactly.
Yeah.
It takes guts for you to travel that far.
Yeah, so it looks as if we are in our own world, but
they actually seem to be in their own country.
Yeah, physically it seems so. But when you get there, you find that actually we are in touch with almost the whole globe, the whole world. We have various collaborations with, for example, Colgate University, that's based in the US, Stanford University, Bara University of Science and Technology. So our collaboration is both local and international. And this is aimed again at ensuring that we do not duplicate services. What we want to do, we want to, get the best we can out of every coin that we get.
Okay, those are very interesting ways of engaging the community, especially without government, to get the very best out of them. But how best can private clinics actually be able to work with government in enforcing such health care? Because right now, I mean, the battle is back to government and back to town. I mean, this is way far off in the forests, but we're back to the centers. I'm talking about health insurance, and here you are having something small that seems to be working. How best can private clinics be able to work with government to ensure effectiveness?
But government doesn't have enough money to provide health care, quality health care for all its people. It has to be a collaborative effort. Everybody works together. We happen to be fortunate that our member of parliament is no other than Mama Mbabazi. Do you know him?
Yes, I do.
Yeah, he's our friend. And so he's been helpful. So we have a collaborative effort with government, and as Dr. Bwindi mentioned, the patients. They pay a little health insurance scheme.
Okay.
And so they're more likely to advocate for quality health care.
Okay.
And then I think you need to bring in the Bazungu, the Western. You need to bring in donors, because it's good for the donors to share what they have.
Exactly.
So we have this collaborative effort where government supports the hospital, the people are supporting the hospital and advocating for quality health care, and then you have external donor support. We have a local expression, agari hamwe nigo gate gufa, which means it takes all the teeth to break the bone.
Okay.
And the bone we're trying to break.
That's a good one.
Nemanja, you know that one.
That's a good one. Yeah, it's a good
It's
one.
Ruchiga expression.
Yeah.
And the bone to break is healthcare. And how do we do it? And I think it has to be done in a collaborative way, and as Dr. Bwindi said, with information technology, so that you know where to deliver the healthcare, and then something where you have accountability, so the donors realize that every coin they spend has been used wisely.
Okay. Thank you so much. It's been really nice talking to you. And we've been talking about Bwindi Community Hospital, one of the hospitals that has done a lot in transforming the health of the people of Batwa, and they've used very tremendous methods that actually can be borrowed, not only at maybe community level, but also at the national level. Thank you so much. It's been very good talking to you.
It's been our pleasure. Come down and visit.
I would love to. I would love to, and I'll ensure that I do.
Please
Thanks.
welcome.
Okay. Good Morning Uganda continues after this.